I came across this particular article, which is looking at the interaction between the police and those within hospitals concerning mental health. And as you can see here, if we look at the actual article, there's the actual article, International Journal of Mental Health Nursing, 2015, volume 24. Okay, so if we just have a look at the abstract, you'll see here, police officers are first responders to acute mental health crisis in the community and commonly transport people in mental health crises to a hospital emergency department. Right. However, emergency departments are not the optimal environments to provide assessment and care to those experiencing mental health crisis. And it's talking about here in 2012, the Northern Police and Clinician Emergency Response, the NPIRSA team, was set up. So it's about this team and about how they were actually looking at this intervention. It's interesting to note that this is set in Australia. So we have, it's in metropolitan Melbourne, Australia, and it's interaction between the police and the their health services. Now it's quite common actually to find a lot of articles from Australia to do with the medical services, also training. They seem to be fairly or very up with the actual process of research and developing new initiatives. So this is a good source of material here. Okay, so let's just look at the aim of the report. We find it here on this page. Not that clear, not that easy to find, is it? The aim of this study was to describe the perceptions of major stakeholders on the ability of the NPIRSA model to reduce behavioural escalation and improve the service utilisation of people in mental health crisis. So what they're trying to do here, this behavioural escalation, they're trying to keep things under wraps, to keep things calm, not make the situation worse. Looking at the methodology, which you'll see here is actually called methods, that's quite common, so don't worry, that is the actual research design, which you'll see underneath. And you'll see what they're doing. They're using what they call an exploratory research design. They're trying to find out some of the issues, and it's going to be descriptive research. In other words, it's going to, yes, give some statistics, but it's not going to try to generalize. It's not going to use high-level statistics. How have they done it? The participants, a purposive sample, so they've actually chosen key stakeholders. They've been very careful. In fact, elsewhere in the article, they've said they've used 17 people. And those are the people here who they've actually chosen. You can see there's a variety of people going from consumers, career advisors, mental health staff, ED staff, police officers, ambulance officers, etc. You can see under procedures it says the literature informed interviews. So in other words, they've actually looked back to the literature, and from that they've actually thought about what sort of interview they're going to carry out, what the questions are going to be, etc. Looking over the page on their data analysis, they've carried out a thematic analysis of the data. It is a general inductive approach. Remember, that just means that they've had an idea of where they're going from, but they're going to look to see what emerges from that data. And what does it say here? It says a defensible analysis of qualitative data that may initially be varied raw text, and it allows it to be condensed into brief summaries. Okay, so what it's saying, it then goes on to say the data were transcribed verbatim, that's word for word, as you know, and you're organised using colour coding. So that was similar to what we were looking at in class. The codes were developed then. So this is typical. You are going to have some codes, and you're going to go through it a number of times. And as necessary during analysis, codes were either collapsed or split into developing themes until central relationships began to emerge, it said. Each theme was examined for supporting quotes from the data. So what you're going to find is that actually you're going to be using these codes within the article, and they're going to actually probably bring out some quotations which they can then use within the article again. Okay, so just looking at the results, you see there, yes, there was the total of 17 participants. It's not enough for a statistical number in any case, but it's good enough for this. It's a qualitative case study, and they've chosen them carefully, which is you still need to do this. There still needs to be a valid approach, so you need to be careful in how in who you've asked, so that you actually get good answers. Looking at themes which emerged, it says a major theme emerged there, just highlighted, about the challenges created by a standalone police response. So obviously they were trying to get away from that. Okay, and then another theme emerged as a solution to this challenge, which looked at the collaborative strength of the actual organisation, well, the alliance they've got, this M-PESA model. Other themes or other areas which are going to be coming up, it calls them sub-themes. So they basically put those under one of the big theme headings. You've got communication, information sharing, and knowledge skill development. Okay. The third theme, it says, focused on improvements in the person's pathway through service utilization. This idea of a person's pathway, or if you're in the NHS, you call it the patient pathway. It identifies every single step that the patient goes through, and use that as the means for your analysis. Then say 4 areas of this pathway were highlighted as sub-themes, and at the community of contact, the use of police stations, progress through the emergency department, and admissions to the acute medical health inpatient services. So you can expect that these will actually be, these headings will be used within the article. And if you go below, remember the first one was challenge created. Oops. So if you look here, there's the first one, the challenge, and it then goes on to discuss that. And you will see that what you've then got is you've got little quotations like this, which are included to support the statement. So this is typical of the approach you would take if you're going to go down this thematic coding approach. You're going to identify themes and sub-themes. You're then going to have these themes and sub-themes appearing within your study, within your discussion, and you're going to probably use quotations like this to further support that. And finally, you'll see in your discussion here that yes, we've got the findings from the study, but we've also got, if you look for instance here, talking about emergency departments, you've got other existing studies also feeding in to support your findings, and that's what I'd expect you to put within your assignments as well. And a thing worthy of final notation is the limitations of the study here are mentioned. There's always limitations to your study, so you've got to mention those. And you'll see, for instance, here it says, it's kind of justifying here, it was a single second response from a team, and they did actually use people who were purposefully selected. But as it says here, as such, they may not represent all the experiences or perspectives of consumers who were responded to by the M-PESA. So you can't, as it says here, you may not generalize to other areas. However, you know, that's still useful to this particular area, and it all feeds in to the overall knowledge. And other people can read about this, of course, and think about implementing it for themselves. Okay, so there you go.